On behalf of the American Academy of Neurology and in collaboration with Neurology Today, it gives me great pleasure to introduce Dr. Richard Benson. Richard is the director of the Office of Global Health and Health Disparities at the NINDS at NIH. He's also a graduate of the 2016 American Academy of Neurology Diversity Leadership Program. He's a medical student diversity subcommittee member, and he's also a recipient of one of the first AAN Minority Scholarship Program Awards back in the 90s. He also, importantly, I think, is working with NINDS on a strategic planning process to develop our health disparities plan for the next 10 years. And that is so vitally important. The focus of our talk today is going to be on COVID and understanding disparities there. But we really need to attack this, and we really need to figure this out. And without data, we're not going to do it. So, Dr. Benson, thanks so much for joining us today.
Thank you, Richard. Is it okay if I call you Richard?
Please.
Okay.
We can call each other Richard. It's a great name. It's a versatile name.
It's a great name.
Absolutely. So we just really met earlier when we were chatting. We're both Longwood Beth Israel Deaconess grads. Shout out to the Boston roots. And I was looking forward to this conversation because aside from everything that's going on in the world today, not just with COVID, but with, the really awakening of our country and honestly, the awakening of around the world, honestly, of healthcare of disparities throughout all aspects of life. What would you want American Academy of Neurology members to understand about healthcare disparities in our communities overall?
Well, thank you, Richard. That's an excellent question. Let me start by saying that the NINDS it has a mission that deals with these issues. The NINDS is committed to reducing the disproportionate burden of neurological disease borne by underserved groups of society, including racial and ethnic minorities, rural and socioeconomically disadvantaged populations, by funding a spectrum of research from basic science to clinical research and outcomes research, and training the next generation of diverse researchers who have expertise in this committee. So what I would like for our members in the AAN to know is that disparities or inequities in the neurologic community exist. There are many factors in terms of why these disparities or inequities are there. And we have to look at these strategically in order to address them. Yeah, historically, the NIH, since it's a institution that funds research, it's sort of focused on biologic mechanisms related to disparities based on, for example, race, ethnic differences between individuals. But we know that the genetic difference between human beings is very small. What we know now is that a lot of the factors are related to socio-determinants of health. And so we have a long history of groups of people who have suffered based upon societal structures when it comes to certain things in a society, such as poverty, such as not having insurance or low insurance. There are people who actually have insurance, but it's a low quality insurance, which puts them at risk. Being poor or living in overcrowded environments. There are people in the country who live in food deserts and don't have access to fresh fruits and vegetables. And we know that that's risk factors for stroke, which is one of our big neurological disorders. People who have energy insecurity, they may not have access or poor access or lack of access to energy just to run their home. And then people who don't have safe spaces to exercise or to get out because of the neighborhoods not being safe, poor education and nutrition, and some other things that are a lot more subtle, Rich, such as unconscious bias. We do know that unconscious bias does impact healthcare, as well as sometimes racism in terms of how care is provided to individuals. So these are important. And it impacts a lot of groups, African Americans, Hispanic populations, and particular Native American populations. So there are a lot of people who are impacted by this.
Yeah. Great review. Really important. So if an AAN member is watching, or they have a friend or family member, or just whoever, what can people do to do their part to improve this. I think all of us have a responsibility to improve this, to address this, to attack this, to make things better. Just as one example, we had a faculty meeting yesterday in the neurology department, and obviously there's a lot going on that's making us kind of rethink how we do things day to day. And, just one example, our med school and hospital, literally this week, decided to restructure the clinics, like the way we provide care to patients, and get all of our neurologists to join additional health plans, something you just touched on earlier. And that way, if we join additional health plans, we can better serve diverse communities, and despite the lower reimbursements. And, I think institutions like ours, we just need to make that decision. Money's important, making ends meet is important, all that kind of stuff. But serving the community is also important. And we also released, for example, the first ever departmental statement from our Diversity, Equity, Inclusion Committee expressing our commitment to serve all communities. And, again, like I said before about this awakening, just the fact that literally within this week, we've made so many amazing changes to at least start the process. We still have a long way to go, don't get me wrong, but what can people do? That's what our department did. What can AAN members that are watching, what could they do?
No, that's a great question, Richard. I think the start, and you mentioned some great things. I think we're at an interesting point in history. The COVID-19 situation or pandemic has created a point in history, as well as some other things going on in history now that have been viewed and televised throughout the world, have brought us to this point now where this is forefront. And I think it's important for people to educate themselves about the history of how diverse populations have been treated here in the country and some of the inequities that we have in our society, but also to educate ourselves about the unconscious biases that we have, and biases and structures in healthcare that are there, and trying to find ways to address those. And so you mentioned participating in some of these insurance plans that may be that a lot of diverse or minority populations may be a part of. And I experienced that as well when I was working in New York, and as well that I know there were certain populations that didn't have certain insurances that don't have good reimbursement. And so it takes a lot of time and effort to deal with those. So it's important for us to educate ourselves and be aware about those kinds of things. And so there are, in addition to that, unconscious bias training that I think it's important for physicians to take, just to be aware of our own personal biases. The other thing you mentioned, we know that throughout the U.S. that we have regional and geographic differences in terms of access to neurological care. We know that certain populations don't come back to the hospital to follow up for their neurologic visits. And so there are a lot of things that deal with that create inequities, that we deal with that create inequities in our society. Through the NINDS, we're actually now going through through my office, we're going through a strategic plan of how to address health disparities. We actually have a request for information that's out there where we're asking people throughout the country. We want information from health providers, physicians, advanced practice practitioners, nurses, family members, special interest groups, patients. We want to get information from everyone in terms of what they see as inequities or disparities in care. Is it difficult to find a pediatric neurologist where you live? What area of the country do you live in? Have you dealt with any type of any bias in neurological care? What do you see are things that are missing in terms of how neurology is practiced? So we're trying to gather that information as well to try to see, what's out there. We're going to do a portfolio analysis at the NINDS to see what we're actually funding related to some of these topics as well. And when we talk about inequities, we talk about differences based on race and ethnicity. We also look at gender and sex differences as well, regional and geographic differences, as well as socioeconomic status. So we're looking at a lot of different things or metrics when we look at inequities throughout the country. But Just a brief answer to that question, it's important for us to educate ourselves about these things, to try to gain information and see if we can find ways to address those. So at the NINDS, what we're doing is trying to get information, look what's out there, see what we're funding, and then see how we can attack some of these issues. As I mentioned, the NIH, we actually fund research projects. Historically, the social determinants that I mentioned earlier were not things that were included in research studies, but we know that there are people that have expertise in doing this kind of research. It's important to develop multidisciplinary teams where you have neurologists, you have health economists, you have people that are that work with communities, community-based organizations that are all working together to address these issues, to see if we can come up with interventions to address these problems.
That's great. And, kind of along those lines, with COVID-19, it's kind of really brought these disparities and these inequities just to the forefront. It took a few weeks for some of the patterns to be, realized. And, I think I saw some of the first things even in April or May, but, now it's June and I mean, the data is really evolving. How have you seen the increase of health disparities with the current COVID situation? The data that I've seen with communities of color being hit disproportionately. Now, granted, there's a lot of holes in the data, and I think this is something we need to figure out. Some states are not really reporting these data at all. They're just reporting total numbers and not, more granular. But even with incomplete reporting, the numbers are staggering. I've seen reported that African-American deaths from COVID-19 are 2 times greater than one would expect based on their share of the population. In 4 states, the rate is 3, 4, or 5 times greater. I mean, that's again staggering. Also, in the majority of states, Hispanic Latinos, they make up a greater share of the confirmed cases than their share of the population. And in, I think it was like 8 states, it was more than 4 times greater. So I would love to, maybe hypothesize, summarize for our members why this could potentially be. Of course, talk about the need for more research, and also, like you mentioned, funding opportunities for this sort of study.
That's another great question, Richard, and something we have to grapple with. The data is not encompassing, and it's not the same throughout the whole United States. We have better data in certain areas than others. The other population besides African Americans, and you mentioned Hispanics that deal with this, is Native Americans. That's a really large population that they have to be very careful in terms of the infection rate there, and it's really damaging to that population as well. I think the issue is when you think of a lot of the diverse populations, just use for an example, African-American populations, Hispanic populations, most in this country live in your large urban areas and live in quarters that may be very tight. If you use or think, for example, in New York, you have people that live in close quarters in large apartment buildings. And so you have people that live in situations where the spread is very easy because people are so close together. And I think that's true throughout the country in these large urban areas. And so I think that's one reason in terms of the high exposure rate living in large urban areas close together. The other thing is that relative to the morbidity and mortality, you have people that have multiple underlying health conditions, comorbidities that predispose to this increased morbidity and mortality from the COVID-19 infection. You have a lot of African Americans with hypertension. We're still looking at that in terms of how that's impacting the morbidity and mortality, but it's the high rate of hypertension and diabetes, obesity, and other factors. I think that situation, because there are these health disparities out there, sometimes people will blame these populations and say it's because of your poor habits and behaviors that you're affected by this. But as I mentioned, again, the historical context of how people got into this environment is very important. There've been hundreds of years of people being relegated to poor diets, not being able to exercise, and having to develop these tight quarters and these negative behaviors such as smoking to just survive in society. So I don't think we can blame people for the situation and say it's your fault. I think we have to address it and look at ways that we can to decrease this moving forward. But I think all of those things sort of they've brought out the fact that we do have health disparities in this country, and that the people who are the sickest or the most vulnerable are going to be the most vulnerable. And this has highlighted this. And this is not because of anything inherently wrong in someone's genetics or DNA. It's just because of the societal structure. And so I think that's the piece, sort of understanding as neurologists. It's important for us to understand that some of the differences that we see are not because people are bad or because people don't care about their health or people don't care about exercising or educating themselves. It's just because of how society has been set up. And so in order for this country to survive, that we have to embrace everyone in society and try to address those issues.
Yeah, I couldn't have put it any better myself. That was a really great summary. I mean, in medical school, I didn't learn anything about this. College, nothing. Residency, no, like almost nothing also. And I think, at some point this will be ingrained in medical education. This will be ingrained. Well, I think in college education, hopefully it's being more ingrained. I think in medical education, it has to be ingrained. And I think that's going to hopefully change. But it takes, a decade, probably 2 decades, for physicians to kind of be educated on this, from stem to stern. And it's still going to be a while. Having structured education about this is key. I'm, doing an interview like this, we can reach members. But I think one of the fixes hopefully will be through research and more data, and then obviously through education too.
No, that's true. And the other piece, in addition to the research on these areas that I talked about related to the health disparities, we also have a very active training office. And so you touched on the other point. I think pipeline development is very important. We have to invest in the next generation in this country in order for us to survive. We have we're one of the most diverse countries in the world. And so we have to work to educate from primary education all the way up to college and professional school. So we're seeing that the numbers, particularly of Black men in medical school, has dropped now versus looking in the 70s. It's dropped, it's gone down. There were more Black men, there are slight increase in Black women, but a decrease in Black men now versus back in the 70s.
Wow.
And some of that is just because of that's multifactorial, but one is sort of pipeline development. It's important to educate people starting in primary education all the way up through medical school and graduate school. If you aren't prepared in grade school, you aren't going to be prepared for high school, and you aren't going to be ready for college, and then you aren't going to be able to apply to medical school. But if we don't address this, if we don't have people who look like the patients that they're treating, then it's going to make it difficult to sort of understand and comprehend some of these things. It is important to have more training on these issues in medical school. But I think it's also important to have more diversity of people in medical school and graduate school as well. And so that requires pipeline development. I know the AAN has some pipeline development programs, and I was really honored to participate in the diversity leadership program through the AAN as well. That actually, I entered that as a mid-level career person. It was very helpful for me in terms of understanding my leadership style and being comfortable talking about these topics. I mean, I've always been interested in health disparities, diversity training, and all of those. And sometimes, you don't have the agency or feel as comfortable to talk about these topics because people don't see them as being important. And so I think now that program, but then this time and period, this time in history is making it more clear that we have to speak up and talk about these things.
Yeah, couldn't agree with you more. I think we need, a top-down approach and a bottom-up approach. Hit this from every side. Leadership in academia and education, medical education especially, needs to make this a priority. I think a lot of medical schools are doing a better job with this. Just as an example, at our medical school, we have a new associate dean of admissions and a new assistant dean of admissions. And the associate dean is an African-American man. He's a real nice guy, great guy, great, perfect fit for the position. And our new assistant dean is a Hispanic female who's awesome. She's great. And between having people like that to maybe show us the way, and really, help us understand these situations and address it better, I think that's how we make progress.
No, I think that's excellent. Yeah, that's very important to have diverse people in these leadership positions, but then also creating pipeline development where we can have people to move along in pipeline.
Yeah.
And so I think that's excellent.
Yeah, and the American Academy of Neurology got a grant from the Hilton Foundation a few years ago, and have been really working very hard with developing the pipeline. And we have a couple papers that have come out. Got to hit this early. I think one of our AAN foci is neuroscience is cool. Trying to make it for grade school kids, high school kids, college kids. We have a paper coming out. It's embargoed, so I can't talk about the results coming out in neurology about brain health education for high school students and college students. It was a randomized trial using a celebrity way to teach about brain health versus a dorky doctor. That was me. And we tested it in a randomized controlled trial. So these are the types of innovative ways that we need to get the younger generations involved, interested in neuroscience, and attract a diverse set of students, because you're right. If your doctor doesn't look like you, it's different. And I think having those types of relationships and role modeling, that's how we can really truly fix the situation.
That's true, and these programs work. I can say you mentioned at the beginning I participated in one of the first diversity programs back in the 90s. It was 93, 94. Where I was able to attend one of the national conventions. It was actually in Washington, D.C. at that time. And I still remember it to this day. That experience of coming to the AAN convention actually helped me to gain interest, or to solidify my interest in neurology. I was considering cardiology actually as well. But after going to that conference, that actually solidified this for me. And then, things has sort of taken off from that point. But those types of programs really work. And I think it's important. We have programs should have programs for medical school students, college students as well. And then, colleges and universities have to look at programs even for high school and junior high people as well.
That's great. So, just to wrap up, I'd like to mention for AAN members watching about the resources that the Academy has. There's a new featured article on the EDI webpage, the Equity, Diversity, and Inclusion webpage on the AAN.com site. Also, the American Academy of Neurology just came out with a position statement on racism. You've seen this from medical schools, from hospitals, from companies, Fortune 500 to smaller companies. This is... Bob Dylan, the times they are a-changing. It's about time. And, you should, if there's a member out there that hasn't read the statement, I think it's really valuable to read it. And then also, like you mentioned earlier, the new NINDS RFA about health disparities and inequities in neurological disorders, because, at some point in terms of, pipeline and career development, you have to try to choose your focus. And this is just, now that there's funding streams and interest and the whole, you could totally make a career out of studying health disparities and inequities in neurology and in your specific, subset of interest. So it's something that our trainees and residents and fellows especially should think about, and junior faculty, of course, too, should get interested in.
And we also, thanks, Richard. No, it's excellent. And I really was impressed to read the AAN's statement on racism and some of the other things that are going on. And I think it's excellent. Through the NINDS, we actually have some funding announcements out there, notices of special interest related to COVID-19 and disparities. So we actually have a listserv through my office. And so if people want to contact me, I can put you on the listserv. And we right now will be sending out funding announcements quarterly. But if you go and look at the NIH guide, you'll see that there's some funding announcements out there related to some of the disparities in the COVID-19 infection.
That's great. Dr. Benson, Richard, we can call each other Richard.
Yes, yes.
All good. Really great to chat. Really appreciate your time. That was awesome. I think we hit everything. So to our members that were watching, hopefully this was helpful. If you have any feedback or if you would like to learn about another topic, you can shoot an email to elearning@an.com and we'll try to get back to you. Richard, thanks so much.
Thank you, Richard. Have a great day.
Thanks. Take care.
Bye.